Viewers, a major decision has been taken in just the last 40 minutes. We are now can absolutely confirm to you, after having gone through the entire order, that this decision to open vaccines for anyone above the age of 18 will actually be transformative in the fight against COVID, as it rampages, forcing lockdowns across the state and endangering economic activity. Now, the government has decided to go for a very liberalized vaccine policy, viewers. It has not only left major decisions to stakeholders to decide on rollout, but it has also widened the ambit of procurement, and most importantly, viewers, it has allowed the stakeholders directly, those that are manufacturers, to sell in the open market. So you and I, we don't have to register. We can go perhaps to a chemist with our Aadhaar card, get that particular vaccine for ourselves, get vaccinated. The only difference is that you will be paying market rates. That will be decided, of course, by the pharma companies. And because there are now at least 5 or 6 vaccines that will be available in India, market pricing will be determined by you, viewers, by demand. So this is a massive move. Everyone above the age of 18 from May 1, viewers, May 1, which is in 10 days, can go out there and get vaccinated. Madhav Das Gopalakrishnan joins me. Madhav, this is a transformative moment in the fight against corona. The government wants to firewall all of India quite clearly. Also, Madhav, we are being told that the centre has taken this giant leap after a big meeting between the Prime Minister as well as the other health ministry officials. It has also come on the back of a huge amount of criticism, Madhav, that a large number of mistakes might have been made in planning this rollout over the last few months. So in one fell swoop, the government addressing all these concerns. Madhav, over to you for the highlights. Are you connected? I don't think you're connected. Let's try to connect Madhav. Madhav, can you hear me? Okay, we're having a few problems connecting to Madhav, but viewers, widen supply, pricing, procurement, eligibility, administration, all made flexible. All stakeholders given flexibility to customize to local needs. Vaccine for 18 plus from May 1. Vaccine manufacturers incentivized to scale up their production. So all those criticisms that were hurled at the government have been, of course, taken on board. Manufacturers can now release up to 50% of their supply to state governments. The rest can be sold in open market at market prices, which will be determined by demand. Viewers, I think this is a transformative moment. Let's go straight across to some of our guests who are joining us on this show. Dr. Anand Ranganathan here with us. Also, of course, other leading medical experts with us this evening. I'm also joined by our very important Madhav Das Gopalakrishnan to give us the information, as he had a ringside to this particular meeting. But before I go to him, Dr. Ashok Seth, Padma Bhushan and Chairman of Fortis Escorts Heart Institute, also with us. Dr. Seth, what do you make of these moves?
This is a very welcome move. I mean, we've been, for the last couple of months, been disappointed by the fact that we had capacity to vaccinate more people, and yet we were functioning at 50% of capacity. And while for every one person who had vaccine hesitancy, there were 5 others who were not eligible and yet wanted to actually have vaccine. So we were actually looking forward to this. I think this is a huge move forward, and this would actually be a biggest boost to our fight against COVID. Yes, a lot more people will get vaccinated, and we know that vaccination is perhaps one of the 2 important armamentariums that we have at the moment in our fight against COVID. Its effects would be seen in a few weeks' time, but clearly, welcome move. I think we're just going to be able to achieve our targets faster over the period of time than we have at the moment. So absolutely something we've been looking forward to.
Now, obviously, the question, Dr. Seth, the question will be about availability of vaccines. Let me bring in Dr. Anand Ranganathan, who joins the broadcast also. Dr. Ranganathan, very ambitious, very timely, very much needed. I think you were making that point on Thursday or Friday when we were speaking, saying that, look, universalize, liberalize the entire vaccine procurement, as well as obviously liberalize and universalize the coverage. It has happened. Can we do it? Do we have enough doses? Do we have the vaccines?
First of all, Rahul, good evening. It's an excellent decision, better late than never. And as you rightly said, I think all of us have been asking for this for months now. And I think it's a great decision. There are three things here. Number one, of course, hindsight is always 20/20. But I've been saying this from the beginning, that I think a universal vaccination above 45 with comorbidity and above 60 for all was perhaps in hindsight should have been focused on the hotspot areas or those areas that had the maximum spike or peak in the first wave, so that you could, the virus that was contained or entrenched in those places like Maharashtra, Delhi, Kerala, you could have treated those when there was no second wave. The number two point that I'd like to make is, as you correctly put out, how many of, do we have the capacity? I think our capacity would be stretched. But if you look at the number of people we're vaccinating right now, for example, yesterday we vaccinated only 1.5 million people. Our capacity is about 7 million, per day. So we are way below capacity, and that bridge, that gap would be bridged by people who are above 18. So I don't think, at least for the coming few weeks, we would have to worry about, whether we are way over the capacity. I mean, there are two things now very quickly. Number one, you look at the data that has come out from America, it is spectacular. Out of 75 million Americans vaccinated, only 5,800 contracted COVID, and only 75 of them died. 1 in a million deaths after those who've been vaccinated. So there is a clear-cut evidence that vaccine is saving lives. Number two, you see now, of course, it's a great decision, and I'm just throwing in a caveat, just as a devil's advocate, if you don't mind. The point is, if this was done a month ago, we wouldn't have done it in the middle of this rampaging wave. Right now, because we have lockdown in Delhi, for example, and many other states and cities would be going for lockdown, how difficult or easy would it be for people to come to centers to get vaccinated? So that is one thing that the government has to straighten out. We might find that people, although they are not hesitant to get themselves vaccinated, are simply not able to because of lockdowns in many cities. So the government still has to answer this issue and solve this problem. But otherwise, overall, it's a fantastic decision. I compliment the government for this.
Well, I'll obviously come back to you with responses from Sanju Verma, who's the national spokesperson of the Bharatiya Janata Party, in just a few moments. But I want to bring in doctor with us who has joined us, Dr. Vani Rayasam, Senior Principal Scientist and Health Science Communications, CSIR. Dr. Rayasam, what do you make of this? Do we have the doses to universalize our vaccine program? Should it have been done earlier? And if not, why? And if so, why?
Yeah. Firstly, I think it's a great step, as all the panelists have said. I think it's a great step that the vaccine is going to be available to many, many more people above 18. I think that's a fantastic step. And I think now the government has relaxed that many manufacturers and many vaccine developers from the other countries can come in. And I think with those people filling in, I think if there are any shortages, that would be addressed. So I think going forward, perhaps we may have enough doses to vaccinate everybody. And I think it's a great step. That is what I would like to say.
Okay, let's bring in Sanju Verma on this as well as Dr. Sumant C. Raman. Sanju Verma, let me ask you this. First of all, there is already a political fight that is broken out. You might have been seeing the tweets that are being put out by opposition leaders. It's not even been 40 minutes. Of course, it's their priority to take this to a political level. But I just want to ask you this. I mean, they are saying that, look, when we made these suggestions, the government told us that we don't know what we are talking about. And now, when the crisis is out of hand, you're reacting. So again, is this a knee-jerk response to criticism? And could it have been avoided? Did we really need to have almost 1.8 lakh cases before we were to look at this very important step, much needed step?
Rahul, I just want to say one thing. We are all aware of this adage, damned if you do, damned if you don't. And I think the Indian opposition, after having been debilitated and electorally vanquished, I don't expect constructive criticism from the opposition ranks, what have you. Having said that, the moot point and the pertinent question that needs to be answered is, could the step that was announced today and a massive decision by the Modi government, and I want to applaud the government for it, could this have come earlier? So let me be very honest with you, Rahul. The fact is, this is a very critical situation that keeps changing by the minute. It has been evolving, and when in September last year we decided that we are going to engage in a mega vaccination drive, many people even were critical of the fact that maybe a vaccination is not something that is needed in the first place. Who can forget that absolutely juvenile remark by Akhilesh Yadav, who said, "मैं तो vaccine नहीं लगवाने वाला हूँ, ये तो BJP का vaccine है." Even today, I have absolutely no idea whether the compulsive liar and a compulsive contrarian Rahul Gandhi has even bothered to take the first dose of vaccine. So the fact that a vaccine was not necessarily the right way to go about doing things, and the fact that there were a lot of naysayers and doubting Thomases, I think taking everything into account, I don't think the Modi government has been reactive. I think they are still ahead of the curve. I have said this in the past on your program. Narendra Modi is a leader.
So let me ask you, Sanju Verma. No, Sanju Verma. Let me ask you.
India first approach and public opinion matters.
Yes. So let me ask you. A few days back. Okay. Sanju Verma, 1 second. A few days ago, when a similar demand had been made, Sanju Verma, you might recall, the government through the health minister said that, look, vaccines are to be given to those who need them, not who want them. This is what was said by the Union Health Minister. I didn't say it. You heard that statement. I can quote it out for you. Now, where is that gone? That need versus, want. That binary that you had sought to have drawn.
I will come straight to the point. Rahul, let's be very clear. Be it the United States of America, be it China, or be it India. I'm taking the names of these three countries because, USA, China, and India are the top three nations in terms of absolute numbers of people that have been vaccinated by respective governments. Let's be very clear. A vaccination drive in the case of a global pandemic, and this is what experts have said, is based on 3 A's. Availability, accessibility,
I'm going to keep pressing on. Look, I'm going to keep pressing on because even today, the Union Health Minister... No, one second.
Because despite made available, the state government simply did not do their job well. Accessibility to vaccines was provided in states like Maharashtra, despite availability being there. So the Modi government's decision to now not have this need versus want debate and make it more blanket to everyone above 18 years is based on the criminal lethargy shown by...
Okay, so very quickly, for the sake of all of those like me who are a bit confused, Sanju Verma, point well made. You have said that, and this is a fact, viewers, you can check the statistics. In some states, even frontline workers, despite the availability of vaccine, have not been vaccinated, let alone get their second dose. So there is also been, on top of all of this, wastage. But having said that, Sanju Verma, I just want you to clarify this because a lot of people are confused and they're messaging me directly and they're saying that, look, this morning, Dr. Harshvardhan became very, very upset because he got a letter from another doctor who is not a medical doctor, but certainly an economist, Dr. Manmohan Singh, who's right now in hospital because he's contracted COVID, who made, according to the Congress party, the same suggestions, which today the government has implemented in letter and spirit. So what was the point of attacking Dr. Manmohan Singh and calling him ill-informed and almost dismissing him as some sort of an Alzheimer's patient? I mean, you almost made him seem like that if you were to read the response, quite condescending of Dr. Harshvardhan. So explain to me, What's the issue here? Because he made the same recommendations. You've accepted them in letter and spirit. So why did you have to attack him?
Rahul, you know very well that I do my homework before coming for debates, especially your debate. Let me be very honest with you. I read the entire letter, and I don't think that letter reeks of any kind of a snarky attitude, which is what media have been accusing Dr. Harshvardhan of. What did he say? He said two very important things. The first one was, in the latter part of the letter, that your leaders, the Congress leaders, have been taking jibes at the vaccination drive and even questioning the bona fides and the efficacy of Covishield and Covaxin, but they have been applauding the vaccination drive in private. So A, he called out the bluff and the rabid hypocrisy of the Congress. Point number two, he said, when we say that we vaccinated more than 12 crore people, you say don't talk in absolute numbers, talk in terms of percentage of population. But when we talk of active case load, when we talk of case fatality rate, when we talk of overall cases, that time you say, let's not talk about percentage. Let's talk about absolute numbers. Because India's fatality rate at 1.18% is the lowest in the world. So you don't want to talk about it because that would mean giving credit to Modi government. So you will talk about absolute numbers. Till 2 months back, before the second wave, recovery rate was 97.32%. But you said, 97% hardly matters. Let's talk about absolute numbers.
Okay.
So the fact is, you cannot change goalposts. You cannot have this debate about percentage versus absolute numbers based on gross convenience. And I think Dr. Harshvardhan, known to be very mild-mannered, very soft-spoken, at the same time, if you keep needling the government, you expect the government not to respond, and why not? After having done an outstanding job.
So needling was needless. You didn't have to needle the government. It's doing a great job, says Sanju Verma. And that is what Dr. Harshvardhan was trying to say. Dr. Sumansi Raman and Dr. Anand, I'm coming right back to you. Dr. Sumansi Raman first. Yeah. Quick response to Sanju Verma.
Rahul, first of all, today's decision, though a belated one, which should have been taken at least a month ago, is welcome to the extent that this is what virtually every expert was actually pleading for. Everyone kept saying, open the vaccination up. I'm not going to politicize it by saying Rahul Gandhi called for vaccines to be opened up on the 5th of April and the 6th of April, and today it is for 15 days later. Forget about what Rahul Gandhi said. This is not political. The point is very clear. Even now, the government has not put out in the public domain how many doses of vaccine are available with it today, how many of them are going to be available. For instance, we now know that if you take the population, 700 million people roughly need to be vaccinated. Out of these 700 million, we will take it that about 120 million have already been vaccinated, which leaves now the entire set. I have removed those below 18. So there are now approximately about 580 million people who need to be vaccinated. Now, how many doses of vaccine? This is simple stuff. How long is it going to take for you to complete this vaccination process? What are the vaccines which are going to be available? When are they going to be available? Who are going to be allowed to make these procurements? Now, this is again something that people have been literally pleading. I know for a fact that state governments have been writing letters to the Ministry of Health and Family Welfare requesting permission, please allow us to do procurement, please allow us to vaccinate younger people. And I remember when healthcare workers were the only people allowed vaccines for 1 month. Now that was a huge mistake because vaccines in many states, the vaccination levels were very low. We could have vaccinated lakhs of people in that had the government, instead of opening it up on the 1st of March, opened up vaccines by 1st of February. By now, we could have vaccinated many more people and saved many more lives.
So even for that, you are blaming the center, but not willing to hold to account the state governments who perhaps did a bad job of marketing the vaccine, the necessity for a vaccine, and why it is important. Okay, fair enough. I mean, look, you have your point of view. Dr. Anand Ranganathan.
Yes, no, I think Dr. Sumant Raman is spot on in many respects, and I think so are you, Rahul. I think just very quickly 3 points. Number one, I think the government refused to believe Dr. Guleria, who had been saying all along, in fact, so many times on your show, that we simply did not have enough vaccine. Our total vaccine capacity of Covishield and Covaxin was 70 million per month. How is it possible to have, with that capacity, vaccinate 750 million Indians? So it was simply not possible. So in going for above 60 and 45 and above with morbidity, they did well, except with the caveat that I put in, they should have concentrated on the hotspots, i.e. those places like Maharashtra, Delhi, Kerala, and some other places that had very high COVID rates in the first wave, so that you could have constrained COVID. Having said that, point number 2 is right now, as I repeat, you see, because you are about a couple of months late, you can say that you can accept that you didn't get a vaccine, which is fine. The problem now that we face is in the middle of the epidemic, when so many states and cities are going to have massive lockdowns, how are you going to vaccinate people who are above 18 and about 600 million of them? Now, obviously, the government, I'm hoping they were thought about it. But the fact remains that I think Dr. Manmohan Singh's letter, even though I found it quite asinine in most respects, I think he was spot on in one respect that let's not talk about absolute numbers that we vaccinated, 120 million. Let's talk about the population that we vaccinated. But again, him being an economist, let me throw in a counter devil's advocate argument that he's always talked about GDP more than GDP per capita. So, but the fact is, look, I think all of us are in it together. All of us have to work hand in hand. There have been some good suggestions that have come from the opposition.
I think,
there have been some terrible criticism, which is unwarranted.
I think Dr. Anand Raghunathan, you're right in that respect. You're right in that respect. I think, look, the opposition, whether out of a sense of malevolence or competition or just because it does what it has to do, which is to point out failings. So out of good faith, let's put it and give them that credit. Even if they've made that point, and even if there's been accepted today, I don't think there should be, space for chest thumping. Now, let me talk to Dr. Seth also, who's joined us. Dr. Seth, I just want to ask you this now. It's very important because, there has been a lot of skepticism. It continues to exist. A lot of people don't really want to get vaccinated because they don't see the point in it. They're reading in the newspapers that people who've got their second dose are still getting COVID. Why is it important to get vaccinated? And why is it specifically important for 18 plus to get vaccinated? And thirdly, most importantly, since we have now opened up vaccines to other manufacturers which can now export them to India, are these vaccines going to be effective given the fact that we haven't had bridge studies, etc.? So 3 questions, 3 answers from you.
Right. So let's first come to the answer of, are these vaccines effective? The ones which we have in the country at the moment, the Covishield as well as Covaxin, are both effective and safe. But people have to realize, what does effectiveness mean? We know that there is no vaccine which is 100% effective. Vaccine is to prevent disease, not to cure disease. And the prevention at the moment for Covaxin and Covishield is from 70 to 80%, which is after 6 weeks after the second dose. So what that means is that till that time, someone can actually get COVID, will catch COVID, and even after 2 weeks after the second dose, can get COVID. But what has been seen clearly, and that's not just the experience from abroad, that's the experience of India. You would probably have heard that there have been doctors, healthcare workers who've been actually have got COVID after having had 2 doses, and that's been the case in our hospital. But clearly what has come out to be that is rare. Firstly, it does provide protection, and secondly, most importantly, that it does provide protection from serious COVID and certainly from deaths from COVID. There have been no deaths in vaccinated patients of COVID. So that's the first aspect. It protects you. It protects you from severe illness and dying, and those are the 2 hard endpoints, and that is the whole purpose of vaccination of the population. If it goes away like a common flu, then that's fine. That's nothing. We have flu regularly over the years. The second aspect that you asked was, what about these vaccines from abroad? And that second point of the more vaccines are welcome. we must remember that the production of vaccines, the ability for India, even for the Serum Institute of India to manufacture vaccines like 100 million doses in a month. But what stops them is the fact that if you pay 150 rupees, which is perhaps doesn't even get you even a good cup of coffee for a vaccine, then they have no incentive to manufacture that amount of vaccines. And every increase in vaccination production means investments. And if you don't have returns, these are private limited companies, there are no investments. I think if we incentivize, and that's what the government has done, the incentivization comes in, clearly we have the ability to make more and more. We have the ability to get more and more vaccines from abroad. And by the way, bridging study is a very important aspect which has been traditional, but there's also the aspect that vaccines are emergency use authorization and therefore will not be sold freely in the market till that emergency use authorization finishes and till a parallel bridging study goes along the way. By the way, if we really wanted to do the studies of Indians, we could actually even look at what data exists for Pfizer, and it has been used in at least 5% or 7% in Indian population of population of Indian origin, and that also gives you 1,000 patients to understand what's happening to these vaccines. So it's nothing like, it's not sacrosanct. When lives are at stake and when we are at war with the virus, all emergency use authorizations are under scrutiny all the time, and we are able to detect any problems which occur. So that's your second point. And could you remind me of the third point that you were saying, Rahul?
Yeah, the third was a very simple one. The third was a very simple one, and that was about 18 plus population. Now, we know that certain vaccines like Covishield, etc., are supposed to have shown that younger people are more prone to clotting, etc. Now, is this a valid fear, or is it so minuscule, it happens so fleetingly that one should not even bother about it?
So I would say very clearly that it's a 0.00004, which is 4 in a million incidents of thrombotic complications, which happen approximately 2 to 3 weeks after the 10 to 2 weeks after the first dose, and is usually in younger ladies, and therefore inconsequential compared to the risk of thrombosis developing from acquiring a COVID, which is at least 1,000 times higher. So we want you to understand those aspects. And secondly, it is this young age group which at the moment is more prone to developing COVID. We, by the way, in this variant are seeing a lot younger people who are actually getting more serious and succumbing to it. And that's the big difference from last time. It may just be the fact that it's
Dr.
a variant
Ranganathan wants to come in, and Dr. Sumansi Raman right after.
The fact that they're more out. Please go ahead.
Yes, excellent points were made. Excellent points were made by the previous panelist, the good doctor. I'll just add a couple of things. I think, as I was saying, that perhaps 2 months ago, they should have concentrated on the hotspot to start the vaccination. I think they can still do it right now. Maybe they can categorize the all over 18s and go preferentially for those in Maharashtra and all the other hotspot areas, because I think that's very important. And number two, why not? I think India never does that. I think we should have a very small state where we rapidly vaccinate all. For example, let's take Sikkim or let's take Nagaland. So that would be a fantastic data point for us to evaluate all the vaccine efficacies and how it is going to help, in eradicating this disease. Maybe, to get the herd immunity. Right now, what we're doing is we've spread thin and we spread all over India. So by the time we get the data of how much vaccination is required to get to herd immunity, it would be here.
Yes. Okay. Very quickly, 2 more remarks coming in. Dr. Sumansi Raman, and after that,
Rahul, of course. I want to point out, in January, Pfizer was interested in supplying vaccines to India, which is why they actually did make out an initial application. They were then told by the government, you do a study in the Indian population, a bridging study or a pilot study in Indian population, and come back. At which point they said, no. 3.5 months later, we are now saying, okay, you don't need to do the study, we will approve your vaccine.
Okay, so look, Dr. Raman, very quick response from Sanju Verma, because look, I understand that, for a certain persuasion, nothing will be enough. Now, yes, you could have done it 3 weeks back, you could have done it a month ago.
To do with political,
but fine.
Rahul, tell me.
What is the point you're making? So either Pfizer
was being used in 20 or 30 countries around the world. When we didn't have a vaccine at
So what is the point you're making? Sir, do you know that the Pfizer vaccine, I'll just tell you one thing, 1 minute. The Pfizer vaccine requires, no, 1 minute, listen to me. I'm reading out a statement that has been put out. No, 1 second, please. No, you're getting me wrong. You're preempting me. This is a fact that I'm going to just put out here. Now listen to me. This is a very, very important one. The Pfizer CEO has made a statement just today that America will require a third dose of Pfizer as a booster because its efficacy lasts only 6 months. Now, India is a massive population, sir.
Do you know how long
I mean, I'm just saying, now you've changed the goalpost. You were talking about Pfizer. I'm only coming back to you. Let's not jump into the... 1 second, sir. You were talking about Pfizer. I'm only responding on Pfizer.
They were the first vaccine...
I agree with you, sir. But look, Pfizer itself is saying that 3 vaccines will be required. Every 6 months you need to be boosting your immunity with our vaccine. It's a gargantuan exercise. Anyhow, I don't want to get bogged down in the specifics.
We don't know.
Look. Doctor, I'm only quoting what Pfizer CEO is saying. Yes, Sanju Verma. Final thoughts from you before I take a break. Yes.
That is why they have...
Rahul, a panelist mentioned that, we could have decided to take the Pfizer vaccine, at least given an approval to this company, maybe 2 months or 3 months back in January 2021. So let me tell very politely, I would love to be corrected. Pfizer, Moderna, these vaccines, if they have to be exported to India, they need FEC approval. And I'm told the FEC approval for Pfizer and Moderna is still pending, point number 1 and point number 2. For everyone who is saying the government...
You're right about that.
Do you know,
Dr.
even the
Seth
World
made the
Health
same point.
Organization
You're right.
last June said that the remdesivir injection is not safe.
Okay,
but today everybody feels that that
Sanju
is
Verma,
life-saving for people on oxygen or ventilators.
I think by and large, the entire panel... Okay, Sanju Verma, 1 minute. Let me just come in.
So for everyone to be smart and
by and large,
I think that
the consensus... I need to take a break.
The government is right on ball in doing what it is doing.
Okay. Now look, you're a government... Look, you're a BJP spokesperson, but nonetheless, I think 2 points have to be conceded. That this is a fantastic move. Maybe, 3 weeks, maybe a month too late, but nonetheless, it's a fantastic move. Now what is important is, let's get our hands out of our pockets and let's ensure that we get jabbed. And this hesitancy must end. And to that effect, I think what Dr. Seth said, Dr. Ranganathan said, very, very important. And even what Dr. Sumansi Raman said, important, that the vaccine is the best action point right now against COVID, because even if you were to get it after vaccination, the symptoms will not manifest themselves in a way that could pose a massive threat to your life. I'm taking a break now. Please, I'm taking a break. Okay, small break, and I'm coming right back. Viewers.